And still a focus on matters of health is that cervical cancer is highly preventable, but poor access to prevention, screening and treatment contributes to 90% of the deaths. From Kariobangi North, our reporter Harry Chimea brings us the story of Pamela, whose life has been vastly affected since her diagnosis, although she shares her story bravely in an aim to create awareness on cervical cancer. Take a look.
Pamela Mbais is among the many women in the country who aren't fortunate to combat human papillomavirus, also known as HPV, in their early years.
2015 nikawa natokwa na damu kidogo kidogo. Nikaona pengine ni age inafika sasa ile ya menopause. 2016 pia ikawa inatoka tu. From January to December. Nikienda hospitali naambiwa hatuwezi kukuangalia kama damu inatoka. Hata mamangu mzazi nilipompigia akaniambia hiyo ni kawaida tu kwa wamama, itakuja isha. So 2017 nikaenda hospitali nyingine, daktari aliponiangalia akaniambia, Pamela, we are very sorry, uko na suspicious cancer.
4 years ago, news that she had cervical cancer stage 3 shattered her world, and she understands the stigma and pain that comes with battling cervical cancer.
Niliona kama mimi si mtu, nikaona tu maisha yangu imeisha. Kwa sababu mzee tayari alikuwa ashanitoroka wakati nilikuwa nikitokwa na damu. Nikawa niko na watoto kwa nyumba, siwezi fanya kazi. Damu inanitoka na kansa ni kitu mbaya. Kwa sababu hiyo damu inapotoka unanuka, huwezi kukaa kwa watu. Unakaa peke yako, unaona uko dunia nyingine. So baada hiyo report, mimi nilikuja mwenyewe kwa nyumba, nikaona sina maisha. Nikaenda kwa chemist nikanunua rat. Kachukua nguo zangu nikazimwagilia mafuta. So nilikuwa tu nataka nijiue.
Though she first learned of a condition in early 2017, she sought treatment in 2020 due to financial constraints. Although months of painful therapy have helped stop the bleeding and pain, the mother of 3 says she opts to have her uterus removed. But due to her financial constraints, she's not able to afford the medication, let alone the surgery.
Kama sasa kuna makaratasi ambayo nilipewa, nikirudi niwe nimefanya hiyo blood works, nitoe. Nikimaliza ni book sasa ndio nione daktari. Siwezi enda kama sina hiyo pesa. Kama kuna mtu anaweza jitokezea anisaidie niweze kumaliza hii matibabu imebaki, nitashukuru sana.
Pamela has now taken on a fresh battle, helping and encouraging patients to cope better with the disease. Cervical cancer occurs in the cells of the cervix or lower part of the uterus connecting to the vagina, and it is estimated to cause 3,286 deaths each year in Kenya.
Cervical cancer is caused by human papillomavirus, especially the type 16 and 18. There are other strains of human papillomavirus that cause warts and also can cause the cervical cancer, but about 70% is caused by strain 16 and 18. Because one of the risk factors is early sexual debut, having multiple sexual partners or having a partner that has multiple sexual partners. And also when you have other infections, other sexually transmitted infections ongoing, that increases your risk of getting the infection and eventually it transforming to cervical cancer.
Dr. Rita Rogo says the treatment options depends on the stage, but if detected early, it is curable.
The treatment options will depend with the staging. We first of all have preventive measures. So for children, for girls under the age of 10, we provide vaccines. There are different types of vaccine, Gardasil, Cervarix, you can get the vaccination for it. If you're between the age of 25 to 49, we still do screening, or even beyond that age, beyond the reproductive age, we still do screening. That's to prevent it. In terms of managing it, once we've made a diagnosis of cervical cancer, we do what we call staging. So depending on the stage, that will determine the kind of treatment we'll give you. We can do what we call ablation, which is like burning the area with heat. We can do what we call cryotherapy, or we can even do surgical intervention. Yes, we can. If the cervical cancer is advanced, we can do surgical plus chemo or radiotherapy. So that is chemo and radiotherapy. Or we can also do palliative care. It's very advanced. Yeah.
With January being Cervical Cancer Awareness Month, women and girls worldwide are being encouraged to go for pap smear screening regularly and get vaccinated so as to eradicate this disease.
Thank you, Harry Chimea, for that story.